The Elliot NICU is a special place for many reasons. One of the reasons why I enjoy working in the Level 3 unit is that we really do take care of the sickest babies within our region. Our team is here 24/7, and we are prepared to deal with unexpected, critically ill infants, both preterm and babies born at term, which should be reassuring to expectant parents in that even though best laid plans don't always go accordingly, that we are there for unexpected situations, and we're there to provide confidence, reassurance that we can take care of their infant and help guide them through this process.
My name is Raven. This is Alessandra. She was 29 weeks gestation when she was born, so 11 weeks early. I was really scared. I didn't know, what was going to happen. She was so early that we didn't know, so I was in a panic. I got here and the NICU team came up and talked to us relatively quickly after I was admitted, and they put my mind at ease almost instantly. They had a game plan. They knew exactly what was going to happen when she decided to make her way into the world. It really gave me the peace of mind that I needed to successfully make it through those couple of days, not knowing what the outcome was going to be. I think it was only 3 hours after I had delivered her that they brought me up here to meet her for the first time. I cried, of course, just looking at her in there, and she was so little. It wasn't what I expected to be the moment of meeting her, but I was overjoyed. I got to meet her first night nurse, who was amazing, and from then on, it was just very consistent, very routine. While I was still admitted here, we came up and checked on her a couple times during the day, and I've been visiting once a day with her ever since.
So when babies are admitted to the NICU, parents are scared, overwhelmed, learning about their new diagnosis that their baby has, but they're also grieving the loss of what they thought would be a normal delivery. Many of them didn't get to do skin to skin as they thought they would, or hold their baby and take pictures after the birth as they thought they would have. So we want to make sure that we're able to foster that as much as we're able to.
I want to say it was probably only like 3 or 4 days after she was born, and I came into the room and she had her very first scrapbook page hanging on her cabinet. Her nurse had gotten some pictures of her and put together a little page about getting to snuggle with mommy for the first time and how she loved it, and she dated it, and every milestone that she hit after that, they would document in a little scrapbook page for us. They're always taking pictures with her and her stuffed animal to compare her size and how much she's progressing and growing. So that really stood out to me as something that they don't have to do, they choose to, because they know how important it is for parents to be able to look back on those moments and remember what it was like. When they're here with her, she is their primary focus, and I love that. It makes me feel really, really good to know that she gets that attention even when we're not here.
I think it's a very unique experience to be a part of somebody's birth, transition, see a baby go from maybe on a ventilator and a breathing tube to then having the tube be pulled out, start crying, putting babies in their arms for the first time. I think just kind of pulling the family together is really what makes it special. We know that we are a part of their journey, whether we intended to be or not, and we try very hard to take pride in that.
It has been a very emotional journey, just not having her at home with us like we should, but knowing that she's in the best possible hands is really reassuring.
The Elliot NICU is special because it's staffed with people who are from the area, and so they know how much it means to these families to have this resource here in Manchester, because it means that even if their baby is very sick, we're able to provide them all the care they need right here, very close to home.
For us, transportation-wise, where we're coming from, where we live, I would prefer to have her here. Going to Boston would be a lot for us every day.
So it really feels like a community where we are a part of the community, helping our community by taking care of babies.
I'm super happy with the care that we have received here at the Elliot. We couldn't be happier with how everything worked out in a situation that we just didn't know what the outcome was going to be.
So being a level 3 NICU is a huge responsibility. We're the only level 3 NICU in southern New Hampshire, which means that we can provide all kinds of respiratory support to babies and that we have some pediatric subspecialties, particularly pediatric surgery. We're currently in-servicing our staff on a special type of ventilator that you use on very premature babies that provides very small, frequent breaths. So we're always making sure that we're staying on top of the best technology for the babies in the NICU. Many hospitals in this area are, capable of providing emergency care, but there is something special about having the level 3 NICU where that baby needs to go right there in-house, because it means that mom is recovering in the same place that baby is getting that highest level of care. So every family, chooses where they're delivering for certain reasons, but it's an important thing to keep in mind whether or not there's a NICU there that can provide the care that your baby will need going forward.
So at the Elliot, we have a designated transport team that is pulled from within the staff of the unit.
The leader of the transport team is typically one of our neonatal nurse practitioners or one of our neonatal physician's assistants. Additionally, we have specially trained transport nurses on the transport team, as well as a neonatal respiratory therapist. Our goal for every transport is to be out the door within 30 minutes from when we get our phone call. And we transport babies from 12 different community hospitals throughout New Hampshire, and our transports extend often into the northern tier of the state, and our team is ready 24/7 to help these hospitals out.
So a lot of times when we go out, most often it's for respiratory support. Wherever the baby is born, if they become sick and that was unanticipated, they need to transfer care to a higher level. There's only 2 NICUs in the state of New Hampshire, so we do a lot of that transport back to ourselves to stabilize and give that extra layer of support and coverage that they need.
We also receive babies very commonly who have had neurologic issues after birth and may require going on a cooling blanket to help stabilize their neurologic system and help reduce brain injuries. Over 50% of the babies that receive the therapeutic cooling blanket come from outside hospitals. So we're very proud of the fact that we can offer therapeutic cooling on transport so that we can start that treatment right at the outside hospital.
Well, I think I work with a great team of doctors and a great team of nurses. I think our unit takes a lot of pride in our outcomes and how well we grow and send our babies home. And I feel very good about working here doing that.
So this is Oliver Sawyer. He was 28 weeks when he was born. He was only 2 pounds, 5 ounces, and the diaper they had barely fit in the palm of my hand. I was afraid to hold him in the very beginning because he was so tiny. And having all the staff there to exactly show you and position you, because your child's hooked up to more cords than you can ever possibly imagine. You think something's going to happen, but they position, they know exactly how long the baby can handle, and then they put him back in. I can't imagine being in a NICU that didn't have level 3, because you wouldn't have access to all of these resources to help make an already hard time a little easier.
We have a lot of support services in our NICU. We have lactation support every day of the week for moms that are hoping to breastfeed.
For the babies, we have physical therapy, we have occupational therapy, they do infant massage, we have speech therapists who come and work with babies on how to bottle feed, because sometimes bottle feeding is a very difficult skill for the babies to learn.
We have music therapists who, for our older babies, is a wonderful developmental experience for them. And then we do have cuddlers as well for babies who need extra rocking and holding, or whose parents live a little bit further away and can't spend as long of time.
Families rely on us to communicate with them daily because they go home at night and they're trusting us with the care of their babies, and so we need to keep an open line with the families.
We have something called family-centered rounds, where we will invite the parents to come sit with the team on rounds, and they can be part of the conversation, and it gives them the most up-to-speed information with the providers present so that they can get a sense of what the medical team is planning for their baby.
We tell parents all the time, you can always call us 24/7, somebody's always here. We can answer any questions that you have with them. I think the parents end up getting to know most of us pretty well. And I think it just adds to their sense of ease at going home at night, knowing that, the babies are in good hands when they leave.
We also follow a large portion of our NICU graduates in the NICU follow-up clinic. And so every 6 months until they're about 2 years old, we'll follow some babies that leave our NICU. And we get to check in on their development, how they're growing. And the parents are always so grateful for the care they receive, especially from our nurses who really form such a tight bond with the families as they move through the unit.
The nurses became family. A couple of them are even planning to come to his first birthday on Saturday. I developed a deeper appreciation for all that they do because they didn't have to love him like they did. I just appreciate them so much.
One of the most rewarding pieces of my job is when we see babies who've had a great outcome come back and visit us at our outpatient clinic or come back to our unit, and we can celebrate how well they're doing, and you get to see this wonderful family growing together.
Sending babies home, seeing them going to school, seeing their school pictures come through, it makes it worth it.
It's so much fun to see the families come back and know that we made a difference in their child's life and then actually in the parent's life as well.
I just have to say how grateful I am for the support of all of the staff here, in the NICU for, not only for supporting Allie and helping her grow and thrive, but for being there for us as well in such a vulnerable time in our lives.
To the Elliot NICU nurses, thank you. We have our family because of all of you. We're so appreciative every day that you saved our little boy. And you will always remain special in our hearts and invited to every birthday that he celebrates from here until he no longer wants to have them, because we're so grateful for all that you did for me, for my baby, and for our family.